Hey everyone, Dr. Charlie Johnson, physical therapist. I want to share with you 4 telltale signs of hip arthritis. Okay, so how do you know if you have hip arthritis? I'm going to go through the 4 signs, but keep in mind that if you've been going somewhere and you've been getting treatment for your back pain or a problem within your pelvis or SI joint, and or you've been treated for piriformis syndrome because you have some pain in the buttock and you're not getting better, then keep in mind that you could be having, or some of your pain could be caused by your hip. So what we know is that in about 30% of people who have back pain and kind of pain in the buttock or going down the leg, they also have hip arthritis, okay? And this is usually older or, just to save myself, wiser folks who start to develop this condition that sometimes is tough to tell from kind of the back, the pelvis. It's also intertwined. So I'm going to go over 4 specific telltale signs, okay? The first and most obvious one is that you will begin to have less motion. Again, we're talking people greater than 50 years old for the most part. You'll start to have less motion in the hip. Progressively, the motion will get worse and worse. So maybe you can't move the hip as well as you could, say, 6 months ago. The 2 specific motions that you'll notice are really difficult will be if you lay on your back and try to bring your hip or your knee up toward your chest. You'll notice that your hip, maybe you get a little pinch in the groin or pain in the groin there. You'll also notice that if you lay on your back and kind of bend one knee up with your foot on the ground and try to let that knee fall out to the side, or if you try to sit like Indian style, the leg is just not going to go down as far, and you might get some pain in the front of the hip, and it's going to kind of wrap around to the back of the hip, okay? So your motion is going to get worse and worse, and you may notice pain, if you try to do a squat because you only have so much motion that you can get into. So the second thing is going to be groin pain, buttock pain. Those are the 2 big ones. So it's going to be right in the groin. I don't know if you can see this, but right in the groin, and then sort of wrap around the buttock. You would have what we call like a C sign, okay, literally C sign, a positive, meaning it's going to be there. A lot of times what we see with people who have problems within the joint is that they take their hand like this and they kind of wrap it around such that the thumb is on the front of the hip and kind of the fingers are towards the buttock. So it kind of wraps around the hip. So we call that a C sign. That's where your pain will be. And what we know is that the nerve that controls the hip actually also kind of controls feeling down towards the knee. So with that being said, a lot of times what we'll see is that people with hip problems or arthritis in the hip will think that they have a knee problem on that side because they're getting knee pain, when in actuality it's all coming from the hip. So a lot of times we work on the hip, get that feeling better, and their knee pain goes away. There are even cases such that people believe they have knee pain so bad that people have gone in, they do a total knee replacement, so give people a new knee, and excuse me, and after the total knee replacement, the knee pain is still there. Then they have a total hip replacement, or they get treatment for the hip, and the knee pain goes completely away. So the knee, just real quick, kind of like a little nugget here, if you have bad knee pain as well as some groin pain, it could be that the hip is causing all of those problems and sending signals which make your knee seem as though it's a problem, okay? The next thing is that what we see is that there's less motion and more stiffness after you've been resting for a while. So sitting in one position for a while, especially if you're in a lower chair, or in the morning when you wake up and you haven't moved for a while, you're going to notice that the hip is really stiff, all right? And the more you kind of wiggle it around and loosen it up, you may notice that it actually feels a little bit better. That's very consistent with the trend of like what arthritis feels like. So rest actually makes it feel a little bit worse, in that it's really stiff and kind of achy when you get up. When you move, it starts to feel a little better, all right? And finally, not all the time, sometimes you can have back pain, but if you can move your back around in all different directions, and it doesn't cause your hip pain, then that's a telltale sign, and you should have no leg pain, numbness, or tingling, all right? So that would be like sciatica or some nerve problem in the leg, okay, not your hip. So here's the 4 telltale signs of hip arthritis. If you've got a hip problem and or you have some knee pain, you're not sure if it's coming from the hip, and or you're just confused about what could be going on. Maybe you're thinking it's coming from the back or the pelvis or something, and you're not exactly sure what's causing it, email me at charliejohnsondpt, that's as in Doctor Physical Therapy, at gmail.com. Subscribe for more videos, like, comment below with your hip pain story. So hopefully this helps you out. Thanks.